Pregnancy and childbirth are hard enough as it is, but what about for people who have survived sexual trauma throughout their lifetimes? Hey there, I'm Dr. Jordan Soper, a board-certified behavioral and cognitive psychologist, as well as a certified sex therapist. And today on Psych Reads, I have a brand new one, both for me and for you, hopefully, that's talking all about when survivors give birth, understanding and healing the effects of sexual assault on childbearing women. This was written by Phyllis Klaus, who is an LCSW, as well as Penny Simkin, who is a pelvic floor physical therapist. This one was actually recommended to me by Dr. Stephanie Bueller, so thank you, Stephanie. I am so excited, and I can't believe I didn't read this before, so we're going to go on this journey together because this topic comes up so much for individuals who go through pregnancy, delivery, postpartum, and really looking at the effects of childhood sexual assault on their pregnancy and their delivery experience. So we're actually going to talk specifically about that topic today, but this book I cannot recommend any more about how important it is to take into consideration the effects of sexual assault on childbearing and on pregnancy, on the entire birthing process from very, very start to very, very finish. Now, I will note the authors do use the word woman really specifically. They're using it specifically for people who identify as female and have the reproductive organs. So they are using the term female here. Not every person who has the reproductive organs to give birth identifies as a female or as a woman. So just heads up, but this is the terminology that the authors are going to use during today. So the chapter we're actually going to read today is looking at the specific effects of sexual assault on the delivery process. So come on, we're going to read something super triggering but so important. So come on, let's take a look. Triggers that threaten a woman's psychological well-being. The birth process is deeply influenced by the woman's ability to trust and respond to the power of her body to open and release the baby. Without this ability, the likelihood of a safe, spontaneous, and fulfilling birth is jeopardized. Understanding and preparing for the events of birth helps any woman to feel more in control and less fearful. For the childhood sexual abuse survivor, however, seemingly normal events and interventions commonly used during labor may have a double or hidden meaning and be especially troubling. We refer to such words or actions as triggers. Although not always recognized as such by the survivor, these triggers bear some similarity to her abuse. Her reactions, which may seem exaggerated or inappropriate, are intensified by such associations. Once this is understood by the women and her care providers, her reactions suddenly make a great deal of sense. Indeed, she has very good reason for the way she reacts. Just as intrinsic and extrinsic describe the challenges that come with childbirth, we are now using the same words to describe triggers. Some triggers are intrinsic. That is, they come with the spontaneous, uncontrollable process of labor and are evoked by previous negative experiences involving the same parts of the body. Painful, escalating contractions, nausea and vomiting, bloody secretions, instinctual reactions like moaning, trembling, grunting, or crying out, and the feeling of the baby in her vagina can evoke conscious and unconscious trauma memories. Her own changed appearance, lack of makeup, sweating, uncombed hair may make her feel ashamed or unattractive. Something as seemingly innocuous as unexpected touch can elicit bodily tension, fear, memories of the abuse, reenactment of pain, and make the woman feel helpless, invaded, or unsafe. Survivors may withdraw from any type of touch, even touch meant to soothe, and may even feel discomfort initially with the baby's body against or at the breast. Some positions used by laboring women, such as on their hands and knees, squatting, or pulling their legs apart, may trigger abuse memories or feelings of helplessness or degradation. We refer to triggers that are not caused by the labor and birth process itself as extrinsic triggers. Extrinsic triggers are evoked by clinical procedures, the sights, smells, and sounds of the hospital environment, clinical staff, or family members, and that may bring up feelings of uneasiness, helplessness, distrust, isolation, fear, loss of identity, and danger. Environmental triggers include the hospital atmosphere, beeping equipment, smells, and institutional appearance. Interpersonal triggers include lack of privacy and quiet, lack of respect for the woman's modesty, conflict with one's loved ones or caregivers, and being left alone when frightened. Care-related triggers include vaginal exams, injections, attachment to machines and containers, being questioned and watched by uninformed strangers. Especially during times of stress, words or actions by the nurse or caregiver can be interpreted negatively or evoke an unintended reaction in the childhood abuse survivor. For example, open your legs, relax your bottom. This will hurt only a little. Relax and it won't hurt so much. These comments meant to help may be the same words her abuser used. A nurse on the phone to a laboring woman, "If you're still walking around talking and eating, you don't need to be here," received by the survivor as rejection. "Trust your body. Do what your body tells you to do." May be meaningless or frightening to a woman who experiences her body as a source of anguish, shame, damage, or poor health. For the women who have spent a lifetime working to disconnect from her body or who has felt betrayed by her body, these words are inappropriate. Vaginal exams, catheters, IVs, sutures, needles can raise anxiety and feelings of mutilation and invasion, as well as trigger horrible memories in victims of ritual abuse. The grogginess, numbness, or side effects of narcotics and anesthesia may also add to feeling out of control, even though they bring pain relief. So, I know that is a lot, but I love the way that the authors really highlight the psychological effects and the activators, the triggers, the internal and the external that can be involved in the birthing process itself. Really being able to take those moments of pause and reflect on the importance of consent, informed communication, validation, checking in with the patient, not just from the medical side, can be extremely important throughout the whole process. And that's really what this book does a absolutely phenomenal job talking about, is how clinicians, how medical providers, how caregivers, how family members, honestly us just as a culture, can really highlight ways that we can change the way that the systems are in place to help survivors. One of the reasons that I feel so passionate about this is the majority of my patients have been trauma survivors during their childhood, and a decent chunk have decided to have children, who have decided to go through the pregnancy process, decided to go through the delivery process, and that whole experience can really make them feel very out of control, unsafe, and triggered. I really hope this chapter got you pausing and thinking about the effects of childhood abuse on the birthing process, and really even giving yourself some moments to reflect, especially if you were triggered during your birthing process, that there is a very good reason for having those reactions. So giving yourself a little bit of validation. Did anything surprise you in this particular chapter? Had you not paused or thought about the impacts of childhood abuse on the childbirthing process. Please put down your comments or reactions down below. I really hope you pick this book up. It was originally published in 2001 and just updated in 2024. So this is actually the updated version. Please pick this up and let's spread the word on how we can really change the childbearing process, especially for our abuse survivors. And I will see you next week for another episode of Psych Reads.